right, let's have a look at this case, which again clearly shows a diffuse abnormality in the lungs. This was referred to our interstitial lung disease physicians a little while back. What do we see? Well, in terms of distribution, I'm seeing every lobe, every segment equally involved. So this process, whatever this is, does not have a sort of zonal predilection, as we might say. What are the patterns that we're seeing? Well, lung density is definitely increased. We've got areas of ground glass opacification, which I think it's right to say is the predominant pattern. Everywhere we look, there are areas of increased density which are not obscuring the bronchial and vascular markings. Classical description of ground glass opacification. However, we've got other areas of increased lung density, here, in the right lung as well, which do obscure the walls of airways and vascular markings. And that is the definition of consolidation. So we've got areas of ground glass opacification, probably the dominant pattern, and we've got focal areas of consolidation. And the distribution of some of those areas of consolidation is interesting because, for example, here, which I've highlighted before, seems to be around the airway and by definition around the artery that would be close to that airway. So this is what we call bronchocentric consolidation. Here's another area of bronchocentric consolidation. And that bronchocentric is an important distribution to consider on CT. But there is another distribution that I want to highlight, and I'm just going to highlight it here. As I trace around this area, you can see there's consolidation smeared on the outside. In the center, there's a little arteriole, and this, of course, is a pulmonary lobule. And when you see one pulmonary lobule, let me highlight a few more. Here's another pulmonary lobule. Here's another one, which is a little bit less well-defined, but there is perilobular consolidation. And here's another, and here's another. Now, when you see perilobular consolidation, you're almost on the home stretch. Because as a radiological pathological pattern, this is pathognomonic for a pattern of so-called organizing pneumonia. And what we've got here is a patient who has widespread organizing pneumonia. Now, before you get a warm glow thinking, I've done my job, I've made a diagnosis, remember all you've done is made the diagnosis of a pattern. This is a radiological pathological pattern. Organizing pneumonia occurs in multiple clinical contexts. So you can get infection, and that can cause organizing pneumonia. You may have a connective tissue disease, and that also can result in a pattern of organizing pneumonia. In patients who have diffuse lung injury in the entity of so-called ARDS, there will be foci of organizing pneumonia. So really, when the radiologist says organizing pneumonia, what is required after that is for the clinician to make a clinical diagnosis. And we then learned that in this patient, who's 72 years old, this patient had been treated with nitrofurantoin. Now, nitrofurantoin is a drug that is given for infections in the urinary tract infections. And this is a complication that sometimes occurs with nitrofurantoin therapy. So this is organizing pneumonia as a consequence of previous drug treatment, or specifically nitrofurantoin.